Today, we're going to talk about a serious and very important topic: Ebola. Don't worry, the explanation will be simple and engaging. What do you know about the Ebola virus? Ebola is very dangerous because it causes hemorrhagic fever. What caused it? It is caused by a virus. Its name is orthopola. It will be more common in Africa. What makes it so dangerous? The reason is its high mortality rate, which can reach between 30% and 90%. This is no joke. So where is it concentrated? Most outbreaks occur in remote areas of Central and West Africa. Okay. So, how is the Ebola virus transmitted? Thank God, Ebola isn't airborne, but it spreads through direct contact with the bodily fluids of infected people or animals. First of all, how does it spread from an infected animal to a human? Through the blood or flesh of the infected animal. So, be careful, my friend. If you have an infected animal at home or in the barn, it can transmit the virus to you through its blood or flesh.
Dana!
And how does the Ebola virus spread from person to person? It happens through contact with the bodily fluids of an infected person, like blood, saliva, urine, and feces. So remember, everyone, keep your distance. Also, don't forget about contaminated objects. Touching contaminated surfaces or needles is strictly prohibited. This means anything contaminated with the bodily fluids of an infected person is a source of infection. So, I'm telling you again, keep your distance from each other. And also, keep your hands away from others. What symptoms might I experience? Symptoms might appear suddenly. They include fever, headache, and extreme fatigue. Are there really stages to Ebola infection? And the answer is yes. It starts with the flu-like symptoms as fever, then gastrointestinal symptoms, finally bleeding stage and other complications. So let's just say things are going to get absolutely chaotic. Literally. Now, let me give you a very simple explanation of the stages of Ebola infection. Stage 1, similar to flu symptoms. For example, a sudden fever, severe headache, sharp pain in the joints and muscles, fatigue, and general weakness. Stage 2, the gastrointestinal stage. This includes nausea, vomiting, severe diarrhea, and stomach pain. Stage 3, the hemorrhagic stage. This means the patient suffers from internal and external bleeding for no apparent reason. For example, blood in the stool, bleeding gums, or bruising. Ultimately, this can lead to organ failure. How is Ebola diagnosed? It's done through a blood test like other viruses. It's called a PCR test. And is there a treatment for Ebola? Treatment, my friend, depends entirely on supportive care. That means intravenous fluids and maintaining stable blood pressure and oxygen levels. What about medication? They might give you immune-boosting drugs, antibodies, such as Imazeb and Ibanga. These are excellent treatments against some strains of Ebola. How can I protect myself from this virus? The first and most important thing, my friend, is prevention. As the saying goes, an ounce of prevention is worth a pound of cure. Like I told you at the beginning of the video, You should stay away from infected people and animals. Are there personal protective equipment options? Of course, like masks, gloves, and goggles. And of course, we mustn't forget the other safety protocols, such as isolating infected patients. This is important. And are there vaccines against the Ebola virus? Thank God, vaccines exist, and they are very effective against Ebola. We give them especially to our healthcare heroes. And that's the end of the video. You need to stay informed so you can stay safe. And remember, knowledge is the best defense. Please share this information with the people you love so we can protect each other. And God willing, I'll see you in the next video. And we hope you're all well.